Hello, I'm Chauhan, a reproductive endocrine physician in Houston. I have a wonderful case to talk about and she has a successful outcome. Miss C is a 32-year-old Caucasian who came to see me for recurrent pregnancy loss. She had two pregnancy losses, one at 6 weeks and second at 8 weeks. No fetal heart was seen in any of those pregnancies, and she had a DNC for both the miscarriages. 25% of all the recognized pregnancy end up with miscarriages, but less than 5% of women will undergo more than 2 pregnancy losses. Chromosomal anomalies is a cause for pregnancy loss, and it can be evaluated by doing a karyotype. A karyotype is a test done on the peripheral blood of an individual, or can be done on any tissue, in which the cells are cultured, the lymphocytes are cultured, and then the cell is broken by different solutions and the chromosomes are identified. These chromosomes are stained to identify any genetic loss. One of the commonest abnormalities we see in karyotype is called a translocation, and I like to explain translocation in an example of a book. As a book has got many chapters, each cell has got different chromosomes. We have got 23 pairs of chromosome, and there is information in each chapter, so each chromosome has got genetic information. In translocation, you lose couple of paragraphs from chapter 1 and it gets transferred to chapter 10. So that is called translocation. The information is all there, but it is misfiled. And something reciprocal translocation is similar, in which couple of paragraphs go from chapter 1 to chapter 10, and few paragraphs from chapter 10 come to chapter 1, in which there is a reciprocal change of information, but these things get magnified in the embryo and then can lead to pregnancy loss. Age. The chances of miscarriage increases as a woman ages. After age of 40, more than 1/3 of all pregnancies end up in miscarriages, and most of these embryos are chromosomally abnormal. Hormonal causes. Progesterone, a hormone produced by the ovary after ovulation, is necessary for healthy pregnancy. There is a controversy about whether low progesterone levels, often called luteal phase deficiency, does it cause repeat pregnancy losses. Metabolic causes. We do know that poorly controlled diabetes increases the risk of miscarriages. Women with diabetes improve pregnancy outcomes if their blood sugars are well controlled before conception. Women who have got insulin resistance and such, who are obese, and many who have got PCOS have a higher risk of miscarriages. Uterine anomalies. Distortion of the uterus due to any cause can lead to pregnancy losses. We think 10 to 15% of all losses are due to uterine anomalies. Antiphospholipid antibody syndrome. Blood tests done for anticardiolipin antibodies and lupus anticoagulant may identify these antibodies, which may be a cause for losses in 3 to 5% of cases. Thrombophilia. These are inherited disorders that raise a woman's risk of blood clotting or thrombosis, which may increase the risk of fetal death in the second half of the pregnancy. Male factor. There is evidence that if there is a DNA damage in the sperm, that may result into abnormal embryo and can lead to pregnancy loss. At this time, the data is very, very early, and it's difficult to quantify the amount of loss related to sperm defects. Unexplained. In half of all the losses, after thorough evaluation, you may not find an identifiable cause for pregnancy loss. So it falls into the unexplained category. This picture is an ultrasound picture, and it's a transverse view of the uterus. You can see that you can clearly see 2 uterine cavities, and when I showed that to my patients, he was surprised to say that he had multiple ultrasound before, but no one had identified two different cavities in her uterus. To confirm the presence of uterine anomalies, a sonohistogram is done. In this picture, you can see two spaces of uterine cavity seen with a tissue in between, which is the uterine septum. Sonohistogram is a test done with ultrasound. You use normal saline as a contrast media, and you insert the fluid with a small catheter through the cervix. With the presence of fluid, you can identify the shape of the uterine cavity far better than a regular ultrasound. In this picture, you can see the two cavities, which may be due to a septum. A second possibility is a bicornuate uterus, which is an anomaly of the uterine shape, and it's a form of malformation of development. This is a picture of the uterine cavity under hysteroscope. You can see that we can see the left corner of the uterine cavity, and you can see there is a septum on the lateral side separating both the cavities. So this is a hysteroscopic view, and septum is here, and this is the right side of the uterine cavity with a cornual opening being seen here. Normal saline is used for a distending media to identify the uterine cavity. Typically, in a normal uterine cavity, you would not see this septum, and you could be seeing a single cavity, not a division of uterine cavity. So, and you can appreciate that this is practically close to 70 to 80% of uterine cavity is divided by this septum. So it's a significant size of the septum. The septum can be complete, close to the cervix, or could be partial, and the minimal amount of distortion could be something called an recurrent uterus, which are normal variation, but it is called an heart-shaped uterus. In this slide, you are seeing the surgery done for uterine septum. An instrument is put through the hysteroscope. It's called Versa point, which has got electricity to help in cutting. And you are just cutting the uterine septum with the electricity. A laparoscopy is also done at the same time to identify the depth of surgery to be done. Because one of the biggest challenges is to know when to stop cutting the septum, as you can overcut it and can be outside the uterus, which can be a dangerous condition. So under vision, you are using an electric current to help cut the tissue, and the tissue typically stretches anterior posteriorly after it's cut, so it doesn't need anything to be removed. Just a simple incision of the septum in the midpoint helps to unify the uterine cavities from two cavities into single uterine cavity. And you can see that we are using the electric current to cut and struggling to find those gentle small movements trying to cut the uterine septum, because a couple of millimeters makes a difference. And you can see we have come closer to the right hand side of the cavity with the septum with minimal tissue left, while there is more tissue left on the left hand side, trying to flatten the edge of the tissue to make it as straight as possible. As you go higher, you will see more and more tissue, because the septum is typically a wedge shaped, and if there's any active bleeding, it means you are not in the right plane. Typically the septum is fibrous in nature, and that's why it doesn't have normal endometrium growing over it, and that's why it leads to miscarriages. And you can see the bubbles are formed as a part of the electricity used to cut the tissue, and you can see that it's a normal uterine cavity. Though the area looks little raw at this time, within couple of months the endometrium will develop and it will be a normal single cavity. prognosis of septum is excellent. In selected number of cases, 80% of the women who underwent surgery on the septum end up having a healthy pregnancy. This patient, after surgery, waited for spontaneous conception. She came back to see me after 6 months, after semester period, ultrasound done, confirmed a singleton pregnancy, and you can see the picture of a fetal heart here on the left hand side. It's a normal heart rate of 160 beats per minute, and there you can see the baby is close to 1.57 centimeters or 1.5 centimeters long, with CRL, with a healthy pregnancy close to 8 weeks, and was sent to an obstetrician for obstetric care. In conclusion, 2/3 of all women who try to conceive after recurrent pregnancy loss will be successful in having a healthy pregnancy. It's important before they embark upon pregnancy to have a healthy lifestyle, have adequate folic acid supplementation, try to optimize their weight, and minimize alcohol and caffeine intake. It's important to stop smoking if they are a smoker, and it's important that they get access to counseling to provide comfort and to help them cope with grief, anger, isolation, and fear, which is very common with such couples.